Big Data in Healthcare by Andrew, Ryan, and Wintow. Data is constantly being collected on countless activities throughout the entire world. In fact, we have so much data we don't always know how to make sense of it. It's not just data anymore, it's big data. When we talk about big data, we are referring to the high volume, variety, and potential for the rapid accumulation of data to analytics, which is the discovery and communication of patterns in data. When it is utilized correctly, it can be a powerful base to lift an industry to new heights. Let's take a closer look at how the healthcare industry can be influenced by big data. The first step is to compile the data in an accessible location, which is begun through electronic health records, known as EHRs. The challenging part is to make sense of this data in order to create a brighter, more efficient future. A common issue in healthcare is multiple visits from the same person, which are known as readmissions. Up to 1/3 of these have been found to be preventable, which leads us to ask, how can we treat them better or correctly the first time? One method is an algorithm based on similar predictive values that patients have. Comparing the patient's personal information versus standards can provide guidance on disease diagnosis and best treatment options. In some cases, this will prevent a readmission through proper care. Of course, there will be other cases where the readmission is inevitable, but with predictive analytics, the doctor could have a better idea of exactly what you need on your next visit. This can be huge for some as we identify adverse events earlier. Adverse events can be different things such as infections, complications with early indicators such as renal failure, and patients who are more likely to have drug addiction complications. The analysis that convert this type of information into knowledge and then into life-saving decisions are still far from a science. The ultimate goal is to improve the efficiency of the healthcare system. The methods of data collection must continue to evolve into an automated, non-obstructive, easy-to-use system. Data will continue to come from sources such as cell phones and wearable devices to enrich the takeaways from the EHR data. New perceptions and forms of data sensing will also be needed to determine what is relevant as we build insights and construct predictive and causal models. Over the past few decades, the expenditure for medical care and public health in the U.S. is more than the healthcare expense of any other developed country. According to the Organization for Economic Cooperation and Development, the U.S. ranks last among 11 countries of equality, convenience, and efficiency when compared to life expectancy. The potential of benefits is enough to have companies, foundations, and the government investing big bucks into figuring all this out. U.S. healthcare has been scrutinized for years on its inflated costs compared to the rest of the world. Many cases have been documented of people flying overseas, receiving a surgery, and flying back for a total cost that is still less than the surgery price here. The substantial investments signal belief that big data will be the primary factor to change this system. The number of tests it takes to diagnose should continue to dwindle, while the effectiveness of the treatment will continue to rise. The end result being that patients, hospital, and governments all save money. Hospitals can treat more patients faster with less work from their staff. The government will have accurate health data on the population and can invest money it's been spending on building the system in other areas of need. And patients only pay for the tests and treatments that they really need. For some patients, that means a lot more than what it does to others. Did you know 50% of all healthcare costs come from just 5% of the patients? These patients are the highest need of being identified early and managed properly. The common theme remains of struggling to figure out how to predict who the patient will be, and then making them actionable is a whole different issue. Though we've mentioned many different challenges, we do believe the answers will be found within the data. Big data will lead to a more efficient, affordable future in the healthcare industry.